Hello, my name is Gerald Lewis. I'm a cardiologist, but I'm also a general physician. I'd like to talk in the next few minutes about a condition which has been a real puzzle and a problem for doctors and patients for many years, and that's the condition of fibromyalgia and chronic fatigue. And although they're quite different, many people have one or the other, and you can get situations halfway between the two. And what I want to do is discuss what it is, what causes it, but most importantly, what we can do about it, because it's a disease which is making so many people's lives utter misery. It's the bane of the doctor, and it's the misery of the patient. The patient has many, many symptoms, and usually all we can do is give a diagnosis. Fibromyalgia basically means your muscles hurt. Tired, listless, depressed, can't concentrate. It's described as a condition which is irritable everything. Irritable bowel, muscle, bladder, heart, palpitations, and irritable mood. And the trouble is, when the patient goes to see the doctor, he or she says, "I don't look sick." The doctor says, "All the tests we do is normal." And in the past, they have often been diagnosed as being neurotic, hysterical, malingering, and usually when the patient leaves the doctor, he says, "I can't do anything to help." And the patient often feels they don't believe me, I feel dreadful, and I just can't cope. What is it? It's a group of symptoms affecting virtually every part of the body. The nervous system with fatigue, irritability, depression, apathy, listlessness, poor memory and concentration, anxiety, and in many cases, suicidal thoughts. The muscles are painful, stiff muscles, stiff tendons, and stiff joints. It affects the gut with nausea, bloating, cramps, diarrhea, and others, kidney symptoms, rashes, headaches, dizziness, abnormal tastes, pins and needles. Virtually every symptom and system of the body is affected. And in most cases, there's a sense of overwhelming tiredness. And as we said, every blood test we do, every test we do in medicine in these patients is normal. What causes it? And the answer is we have no idea. Is it a post-viral illness? People suspect it may have been due to a condition called Tapanui flu or the Epstein-Barr virus, which causes glandular fever. We're not sure about it. Is it due to heavy metal poisoning, such as mercury? Is it inflammatory illness, where the body basically reacts against inflammation and starts damaging the tissues of its own self? Is it due to phosphate poisoning? And some people believe that it's much more common in areas where there's been aerial top dressing and excess phosphate exposure has developed. It could be any or all of these or none of them. We still don't have an answer. Most importantly, what can we do about it? There are medical treatments, drugs. People have tried antidepressants, pain pills, physiotherapy, and these are spectacularly unsuccessful. There's a whole lot of other treatments we can do, removal of toxins, hormones, and supplements, and we'll talk about these in the next few minutes because I believe these are the answer for treating this condition. First of all, mercury removal. It's very hard to do safely. That picture on the right-hand side with the suction pipe and the dentist and the assistant really being quite severely gowned up shows just how dangerous, in fact, mercury removal is. It's got to be done properly. If it doesn't, it can actually make the poisoning worse. And it's important to make sure that you're toxic as far as mercury is concerned before you even consider having them removed. And there's not a lot of data that removal of mercury actually helps. Some people believe phosphates can be the problem. The phosphates get into the cells and glug them up and sludges up the cells and stop them working properly. And there's a compound called guaifenesin, which is found in many cough syrups, which can help remove the phosphates from the cells. And if in fact it is due to phosphate toxicity, very frequently when you start taking guaifenesin, the symptoms can get worse rather than better. And if you are taking guaifenesin, it's important to note that if you have aspirin, it actually blocks the effect of the guaifenesin. Now, although blood tests show that most hormone levels are normal, particularly thyroid and adrenal glands, in fact, many people believe this is the answer. It's also important to check the sex hormones, progesterone and testosterone. If they're low, or even if they're low normal, I think it's important to replace them. It's interesting that many of the symptoms of these conditions can be relieved by giving higher than normal doses of thyroid and hydrocortisone hormones. It's almost as if the hormones can't get into the cells. Normally the hormones need to get into the cells to work, and they just don't seem to be able to do so. But if you give enough, then after a while, gradually, they get into the cells, and then the patient starts feeling better. So high doses of hormones, particularly thyroid and hydrocortisone, can help the patients, but they can have side effects and can cause problems downstream. And although temporarily it may help, I personally prefer not to use these at all unless it's absolutely necessary. nutritional supplements, I think, are very important. It's interesting that some of the symptoms of these conditions are very like vitamin deficiencies. As we know, today's food is nutritionally poor. People with these conditions have got poor appetites, but fibro also affects the gut and absorption. And many people believe that these patients, in fact, are nutritionally poorly off. So it seems logical to give the cells all the nutrients they need to work properly. And therefore, I think it's important for everybody with fibro and chronic fatigue to take a good quality, comprehensive multivitamin, antioxidant and mineral, omega-3 fish oils, but make absolutely certain that it doesn't contain any mercury, and extra calcium and magnesium. Herbal supplements are something that doctors know very little about, but I believe is almost crucial in this condition, because some herbs help the mind and also the body. Ginseng helps the body to cope with stress. It's called an adaptogen, which is exactly what that means. It improves mental and physical performance. Rhodiola enhances the mood, the memory, the brain function, reduces irritability and fatigue, and once again, those are the symptoms of this condition. Ginger has an anti-inflammatory action, eases aches and pains. Turmeric contains curcumin, which also has anti-inflammatory actions. Do they help? Not sure, but ginseng and rhodiola certainly seem to. So I recommend my patients should take ginseng and rhodiola as supplements and include ginger and turmeric in their diet. Now, it's a condition of poor energy. Chronic fatigue says it all. And many of the symptoms are due to blockages in energy production inside the cell. And that's a cell on the right-hand side there. Patients don't have enough energy, and their metabolism is so poor that the buildup of damaging toxins inside the cells makes the situation worse. Now, the Krebs citric acid cycle provides all the energies for the cell, and that's the Krebs citric acid cycle, that blue thing in there in the middle there, and it looks like this. So basically glucose and fats create something called acetyl-CoA. Then as acetyl-CoA goes around the Krebs citric acid cycle, it creates energy, which is what those little lightning strikes mean. And for it to work, the cycle needs fuel, which is glucose and fat. It needs malate in the cycle there, and malate seems to be the important rate limiting thing. When you become exhausted, when you exercise too hard, you run out of malate. And many people believe that patients with these conditions are low in malate. You need L-carnitine to get the fat to the cells. And you also need coenzyme Q10 to create the energy, to turn the energy into the useful energy that the cells can use. And also caffeine can provide energy and mental stimulation as well. So I recommend that my patients should have enough coenzyme Q10, L-carnitine, malate, and caffeine. So what do I advise my patients with these conditions? Number one, check the diet. Check whether foods make you feel worse. And particularly look at grains, dairy, and sweet food. If they do, then it seems logical to avoid them. Check the hormone status, the thyroid, adrenal function, male and female sex hormones, testosterone, progesterone, estrogen, DHEA, and if they're low or even low normal, replace them. Take a good supplement, multivitamin, multimineral, antioxidant, omega-3 fish oils, calcium and magnesium. Take supplemental rhodiola, ginseng, turmeric and ginger in the diet, and take energy supplements, coenzyme Q10, L-carnitine and malate. And this treatment helps nearly all of my patients. So, if you have this condition, go and see your doctor and ask for blood and saliva tests and replace the hormones if necessary. And if you're concerned about mercury, ask for a hair analysis for mercury. Create for yourself a satisfying, non-damaging diet, organic if possible. Take quality supplements, multi, fish oils, calcium, magnesium, coenzyme Q10, and find some malate, rhodiola, ginseng, and caffeine. And unfortunately, that's quite hard to do, but there is a product which contains all of these in exactly the right combination: tea, caffeine, Korean ginseng, rhodiola, and malate, and a nice, relatively palatable drink which you can take as necessary. But because it's a supplement, by law, I'm not allowed to name it. If it was a drug, we could even advertise it on TV and shout from the rooftops. But because it's a supplement, we're not allowed to say what it is. Now, if somebody referred you to this talk, almost certainly they'll know the name of the product and they can let you know about it. Otherwise, I'm happy for you to contact me, and that's my email address there, which I'll put at the end of this talk as well. So just to conclude, fibromyalgia, chronic fatigue. What is it? We don't know. What causes it? We still don't know. What can we do about it? We can do a great deal. So thank you for listening. And as I said before, I'm very happy to answer any questions if you'd like to email me. Thank you.